My name's Mike Weiner, and I'm here to tell you about NooThera and something really exciting that some scientists starting in England, Vienna, and Germany and discovered about Alzheimer's. There are actually two technologies that really work great for Alzheimer's and dementia. And actually, there are more than two. But I'm going to try and make this very simple to try and understand. The work that was done in Vienna and in Germany, when I first became aware of this about 3 years ago, didn't use a photobiomodulation that we're using. They used RTMS, repetitive transcranial magnetic stimulation, which is now approved in the United States for depression. And the research that was going on in Europe was for tinnitus, not for dementia. But they had tried it on dementia patients and depression patients and had very good results. And their theory, which I now subscribe to, was the brain needs a certain amount of electrical activity to sense a certain amount of activity, not to go into basically a neuronal form of apoptosis. And if you give that brain that energy, which they were doing with RTMS in a non-invasive foam pillow that the patient would lie their head in for 20 minutes a day, the Alzheimer's and dementia would stabilize. They wouldn't get worse. And they said it was like vitamins. They were successful at treating tinnitus and unsuccessful at funding the company, and they're no longer around. And to me, it was just an interesting day in the life of doing some due diligence until I got back to the States and I was told about a fellow in Philadelphia who was using an infrared helmet that was developed by physicians and scientists in the UK, and they were having luck. Same story. They were saying, same word, vitamins. They were saying you only need 6 minutes a day and the brain will stabilize. They had evidence in a particular woman who they had stabilized for 18 months with photobiomodulation, which is a fancy word for infrared light, by the way. And they later learned that in addition to stabilizing the tissue, it's possible with infrared light. This is in the literature. It's not something we've made up. You can actually cause neurons to regrow. You can get rapid improvements in nerve pads, dendrites, and synapses in animals and humans overnight. This is in the literature. Now, that's really good because the brain, when it's no longer dying, tends to stabilize. What was discovered in Philadelphia that was very exciting was if you then use neurofeedback, so basically an EEG brain scan where they compare you to the norm and then use non-invasive operands like watching TV to repair your brain back to the norm, the increases in cognitive memory and social behavior and awareness was incredible. It was better than the infrared alone. Now what we've deduced is the neurofeedback works great, and there's studies out. There's one that CNN is tracking in Florida. There have been a number of others, one that recently published about epilepsy. The neurofeedback, which repairs the brain's brainwaves non-invasively, does remarkable things for memory. But it doesn't stop the degeneration of the tissue that's really the big causative problem over time. So the people who know this, but who know neurofeedback and don't know about photobiomodulation, are helping people remember for a period of time, perhaps 6 months, and then they're going to go south again. Whereas what we believe is the optimal treatment is to combine the infrared light, photobiomodulation, non-invasively. There's a number of devices out there that work, and you'll see them well reported in the literature now that they're working for traumatic brain injury, a form of dementia. And if you do these two together you get the best results and you get the best sustaining of the degeneration. Now, it's interesting because both of these technologies that are used in these studies have been shown to be safe and are considered of insignificant risk by the FDA. But knowing that, you are not allowed, under the regulations, to use it on anybody. Because A, if you're a neurofeedback trainer, you're not a physician and you're treating medicine, which you're not supposed to do if you're treating dementia. Now, if you're treating them for better improvement in sports, it's legal because it's not medicine. But as soon as you say we can help you with dementia or Alzheimer's, it's illegal. So that's interesting. The same thing is true with these class 2 lamps that are very safe, known to be safe. Infrared is basically at certain frequencies, certain power, is very safe, and it's used for sports injuries and a lot of other things. But if you combine these two, it's illegal to try it on Alzheimer's unless you have an IRB-approved study. Then it's quite legal. So the study that was done in 2010 was supervised and authorized by an NYU MD and psychiatrist. And the results were really good, but they only had the money to do 11 people. So there was significant results, just infrared, before they tried the neurofeedback. And those results were exciting, and they were presented at a conference where the head of the NIH Alzheimer's program was there, a woman who, as it was told to me, I wasn't with the venture at the time, came up and said, "This is really exciting. This could be a big breakthrough. But you only have 11 people, and boy, that's insignificant to us. Why don't you come back when you have 80? And this is a nonprofit foundation, didn't really have the money to go to 80. So since 2010, this fantastic discovery and lead has lied more or less dormant. But that's their belief. So we modified that, and we don't really plan to announce the study until it's over. Now, it's only 60 days. We get great response, and we really need to go more than 60 days because you can't take somebody and get their family to see a treatment that brings them back and makes them better and then drop them after 60 days. So we really want to try and go longer for the longer-term results. But when the patents on our more sophisticated, I mean much more sophisticated console that can solve many more problems and give you much better evidence are published, we think there'll be a real interest in the device side to get ahead of the pharmaceutical side for dementia and Alzheimer's, and then medicine will have a competitive fight. And I think it'll be a very successful business. And for us, our intention is to treat it like a pharmaceutical development. We want a milestone deal for cash and a 5% royalty or more when the product ships, which we believe we can do the milestone deal in 2017 based on the results we'll have, incremental to the ones we have now. And that then the industry will probably be able to get something through regulatory in about 2 years. Be less than 2 years, but it'll probably take them 6 months to a year to design the more sophisticated product. You might imagine a device that does it all in one session. You might imagine something the patient takes home so they don't have to go to the clinic, because it's not easy to transport an Alzheimer's patient every day to the clinic. So there's a lot more thought behind it. And I'm obviously not going into a whole lot of detail because we want to do this quickly and we don't want to be blocked. So basically, once the patent's published in the industry, particularly the device industry, sees what we have, we think there'll be a lot of excitement in bidding for the deal. We think that pharmaceutical people will bid because they won't want to be left out. But we don't think it's a good idea to let somebody have a position in an industry where they really prefer the drug. Let a device company go full speed to the market. Now, it turns out that GE has a technology called a SPECT scan that can identify Alzheimer's in advance of any memory loss. But there's no market for a diagnostic without a therapeutic, and they don't own the technology that makes their SPECT scan work. So that will come about. My prediction will be that Alzheimer's within 5 years, if we don't take the normal slow route of the industry and its inefficiencies, we can obliterate Alzheimer's and dementia from being a public health problem by turning it into a prophylactic therapy. There's no reason why not, except the industry really likes those cash cows that have annual returns, and I'd just soon fix it, go on and do something else. The technology is definitely considered insignificant risk by the FDA and the EU, and we could sell it in a computer game tomorrow. If we said it was for Alzheimer's, we'd go to jail. So the solution is to fix it and get physicians and other people, not neurologists and psychologists who don't believe in it and don't want to heal the people. Let's have a simpler test, less expensive, more widespread, then show the industry how they can make a lot of money investing and getting it through payer approval and FDA and EU. I don't think our little company should take that burden on or use investor dollars. So we plan to do this for a lot less dollars, but have an outcome that hopefully will be quicker to the clinic than the way it goes today. Now, this is a clock drawing of just the photobiomodulation before they started doing more sophisticated stuff with neurofeedback, and you can see the clock before and the clock after only 5 weeks of treatment. There were, as I say, about 40 people overall, but 11 in this double-blind study. And there was caregiver comments saying that there was a noticeable effect in many people. This stuff works. And yet, scientists will actually argue, what are the long-term results? Who cares? I mean, if grandma's dying and she might get a headache from this stuff, let's keep her alive while we do the studies of what all of the possibilities in the universe. The stuff is safe, and it solves the problem. So it's an amazing conundrum, in my opinion. And I think if enough people realize it and we have more and more evidence, it'll be a very successful business as well as a successful result of industry. Any questions?